Hi, I'm Scott Withers, Democratic candidate for Michigan's 5th U.S. Congressional District, serving Bay, Saginaw, Genesee, and Tuscola counties. Yesterday's election results in Massachusetts have already had wide-reaching political implications and could have devastating implications for every union member and union family across mid-Michigan. Why? Healthcare reform. For the last year, President Obama and congressional Democrats have worked hard to craft a healthcare reform bill. And now they've been backed into a corner. And like any wild animal, they're going to pounce, and they're going to do something drastic, and they're going to do something quickly. Because they don't want to look as if they spent the last year working on this issue, and they failed. They really only have three options left to them. The first one is called Senate reconciliation. The big problem here is it would force the Senate to remove any clause that didn't have to do with the budget. So that means the clause protecting people with pre-existing conditions, that'd be thrown out. The clause that said health insurance companies, you can't drop people that are paying their bills just because they get sick, that clause would be thrown out. The bigger issue with this option is a Democratic senator from Virginia has already said, it's not going to happen. We're not voting on that until the Senate-elect, Scott Brown, from Massachusetts, is sworn in. And Scott Brown has already said he's going to vote against health care. The second option they have is the one that I support, and that's scaling back the health care bills in hope that they can get something passed in both the House and the Senate. You know, we do need health care reform. We need to protect people that have pre-existing conditions and make sure that they have access to affordable health care. And we also need to protect people that are paying their health care but get sick and then get kicked out. That can't happen. The problem, though, is not a single Republican, not in the House or the Senate, is ever going to cross party lines to support any kind of health care. It's not going to happen. Why? They need President Obama and congressional Democrats to fail. They need it so in the 2010 elections in November, they have a better chance of winning more seats in the House and in the Senate. So that option's out. The third option is the one that everyone in mid-Michigan should run and scream and say, please, no. It's horrible for us. While we need healthcare reform, we don't want this option. And basically what it would be is the House would pass the Senate's current version of the healthcare reform bill. It's got all the good clauses that we like in it, protecting people with pre-existing conditions, and it's also make sure that insurance companies can't drop people and offers things to make sure people can get affordable health care. The big issue with it, though, is that it would levy a 40% increase on union members' health care plans, effective immediately. Now, you may say to yourself, well, I know the union members, they went and met with the White House, and they got that pushed out. That doesn't matter. That wasn't put into the bills that were passed. They negotiated it, but the House has to pass the Senate's version without any changes. Otherwise, it can't go to the president and can't become law. So, if the House does that, your taxes on your health insurance are going to go up 40% instantly. Instantly. That's about 70 cents an hour more out of your paycheck to go to your health care. Now, we all need health care, but I know personally I couldn't afford another 70 cents an hour, and I know most of you probably couldn't either. So what's going to happen? I don't know. I do know that the congressional Democrats are going to act fast. In the next few days, this is all going to be wrapped up. I wouldn't be surprised if the president signed some kind of health care before his State of the Union address on the 27th. We just all need to hope and pray that it's not option 3. Because if it is, it's already going to hurt mid-Michigan's weak economy. We can't handle any more taxes. We need to help the businesses we have. We need to keep the pay that we already have. We need to support small businesses and grow them so they can add more employees, and we can expand the economy in mid-Michigan. You know, some of the Democratic Party establishment who've been running party politics throughout mid-Michigan's 5th District for a while have already taken a few jabs at me to say, well, that sounds awfully Republican, helping small businesses. Okay, great. We need to do whatever it takes to get jobs flowing in mid-Michigan. We have to protect the jobs we have, whether they're union or non-union, and we need to grow new jobs. We need to be realistic. It's great that the governor is going out and helping to bring in new companies into mid-Michigan. fantastic. But let's focus also on the companies that we have and help them grow and add more employees too. You can do both at the same time. So to those people in the old guard of the Democratic Party throughout Mid-Michigan, I say, it's time Mid-Michigan has someone with new ideas and a fresh perspective. I'm Scott Withers. I'm a candidate for Michigan's 5th U.S. Congressional District seat, and I hope you vote for me in the Democratic primary on August 3rd.